Hi, everyone. For this week's discussion, we are talking about professional development. I'm going to be the chairman, so I'll go ahead and start and share my goal that I wanted to start for this semester. So, especially in the first semester, I wanted to set a clinical goal for accomplishing the competencies that we need. The program's already laid out a time frame of skills that we should be following. So based on our level of learning, but because there's no set test date, I'm already seeing myself put off this responsibility. So throughout my time as a student, I've struggled with demonstrating my skills in front of others. I'll be like the student that overstudies and but when it comes down to the test day, I overthink and second guess myself. So especially when it comes to presenting myself to others, I have a lot of anxiety. And that's kind of what competencies are. So I wanted to make the goal within that. Thinking about like the critical thinking steps, for that would be like the problem, identifying the problem, step one. For step two, considering and developing like possible viable solutions. Right now, I've kind of brainstormed that I want to achieve what our program director suggested for it, like the 7 competencies for the first semester. So I looked at the dates for it to be accomplished, and I want to attempt like at least 3 a month. So that way, like I've at least tried. And then if I achieve that, then I'll have more than I need for the end of the semester. We have 4 months in the year, but left, but December, I think the semester ends like the first week. So kind of basically 3 months. Um, Another outcome that I was thinking was trying 4 competencies, but I don't know. I feel like that might be a lot. But I think that overall, like my biggest problem is trying it. And I know once I get one out of the way, it'll become easier. As an X-ray tech, it's our responsibility to be professional and be able to present my skills to others, techs, supervisors, it's all part of professionalism. So at the end of the day, we have to be professional to have the best outcome for the patient. Um, that was my own analysis of it. If anyone has any recommendations for it, I'd love to hear.
So just kind of
If
like
not, we
I like how like you kind of laid it out because
Mhm.
I think that's kind of I don't know, at least for me speaking, that might be where we all sit, trying to meet those like requirements. At least myself, I've never worked in the medical field before. So for me it's like new dealing with patients, um dealing with people, talking directly with people and then giving them instructions. Like I'm a tech, so I'm used to behind a computer. Don't really deal with people. I will work with you remotely. Like I'll talk to you over the phone, but just then now adding people to it, I think for me that was a challenge. That's one of the things that you know I'm working on. I'm competent enough that I can read, I understand. I even like I make flashcards and like this is what I need to check off, like for a specific position, distance, this and that. So I get what I have to do, but then the challenging part is doing it in front of somebody. People, at least I'm at CMH, people are super nice. They're very kind. They're when I guess when you go to the doctor, like even myself, like you're like, oh, okay, we have to do this. So people are compliant. People are, so I guess that makes it easy, but just it's still a little nerve wracking that, um, this is what we're doing. Somebody really trusts us. We got to do it. And then I think it was the other day, it hit me. One day, I'm not going to be a student and I'm just going to be out here. So just on my own. And someone gave me a license and said, okay, you're good. You can do this. And the trust that lies behind all of that. So for me, one of the challenges is kind of just moving past of my prior, job experiences to working more in a medical field, um, and then hitting some of those targets. Those targets, like you were talking about, are nice because it really either pushes you to hit those marks and you've got so much, and then if you have the opportunity to just keep going and going, then you do it. But if not, like it builds this like program that you can like kind of take your time with it, move on with it, and still hit every single mark. But at least that's for me. What a kind of like like what you're saying, it's just getting started. I was just debating it, and I think one of the texts for me said, "Just do it." Just and so I was right there with you, like just kind of like, oh, I don't know if I want to do this. I'm learning. I'm helping, like with my other. We are with 4 students, and so we kind of are at some point we're all together at the same time. I think not all sites have students that you guys are together. You guys sometimes are alone. And so we're lucky. We like have that. So we have that support from each other. Okay, like you help me prep the room, you do this. And so I think that's nice, but I could see how it would be a little more challenging if I was by myself.
Yeah, I'm definitely not by myself yet. That would be insane. I'm at Cottage Hospital right now. But I think that the 2 years is gonna go by really, really quick. So I think like for your goal, we could like all like think maybe if we do like if we want to do like 10 x-rays a day like by ourselves is like try to like tell the text I want to practice 10, then it kind of pushes you to have more like patient hands-on experience in the medical field. So you're getting more used to it. I mean, anyone else have any ideas to bounce around?
Yeah, I think that's a great idea just to go off of what you're saying, like setting a goal, even just I think small ones like daily goals versus like um like obviously we have the big end goal of getting the competencies, but I think it's an awesome idea to just go in it like one day at a time and be like, okay, so today, in order to get to my big goal, I'm going to set these little ones and kind of like take it like that.
Mhm.
But also, I like your encouragement, Felipe, because just do it. Like, I sometimes that's you just need a little push, you know? But yeah, it's because I feel like I have the same anxieties too. It's like constantly being out of your comfort zone, like the
Mhm.
whole time I'm at clinicals, basically. Um, but it is also the part of having to present in front of not only like the other techs or people that are watching you and kind of critiquing you in a good way, giving you like feedback that is very like helpful, but like the patient as well,
Yeah, I've been
you know?
in the ER too. And so by the time we do get like a chest x-ray, like a 2 view, and they bring someone in, there's 7 other techs like sitting in there watching. And I don't be
Yeah.
like, can I pass this off? But then there's like actually a whole audience around.
Yeah. Oh my God.
Um, so it's kind of a little bit nerve-wracking, but maybe when I have the department days, it'll just be like me and one other tech. So it won't be too bad.
Yeah.
But I think what you're saying too, like setting small goals each day, and I think they will change throughout the semester as we get more comfortable. So I like
Yeah.
that you said. Do you want to share your goal, Danae, that you have for the semester?
Well, my goal is pretty much like the same as what you had touched on. I haven't even attempted to get a competency yet. So I think that's kind of like where I'm at as well. I think we're kind of in the same boat.
Mhm.
So yeah, that's where I'm at. That and the challenges are, you know, like you had mentioned, kind of that anxiety of having to like, I don't know, present in front of others. So
Yeah. Okay. Bibiana, do you want to go next for yours?
Yeah, for my goal is like the same as you. I mean, like I think in the department, since that we're at cottage and the department, you do get more chest tube views, and the techs do like tell you like, go for it, go do the steps, all everything. But I haven't like I'm so nervous to like say, I'm gonna do it. Let me alone. So that's like I have to stop that and go for it. So that's one of my goals, like for this coming, probably tomorrow, I can sign off for that. That's my goal. Hopefully I can do it.
you can do it.
One of my challenges, I think it's my English. Since it's my second language, I feel like I'm very like nervous to talk. And sometimes I talk very like low. So I've like noticed that the text do tell me like, oh, you have to speak up because I can hear you and that. And I'm like, oh yeah, it's because I'm nervous. So I think that's one of my challenges. So I have to like speak up, and I've been working on it these past days that I have been there. So I think I got a little better, but yeah, that's one of my challenges right now to speak up a little. Yeah.
Professor Steele too talked about this week, about like our tone as well as
Mhm.
like our voice and how it makes patients feel. And so I totally get that. Like when I'm just like blurting things out, the patient, like they can see that we're nervous. We already have student on our ID card. So
Yeah.
I mean, they already know we're students. So like as long as we talk, I notice when I talk like slower and really just actually give my brain time to think what I'm going to say, it ends up being smooth. But then if I have like anxiety behind my words, like it's all jumble mumble.
Yeah.
Anyone else have any input for that? Jessica, do you want to go next?
Yeah, so I do get the speaking up part because our techs, like, they won't come get you. They won't like ask you if you want to do it. They're just like, you have to like come over to them and say like, hey, can I go with you? Or hey, can I try this? Hey, can I try that? So that is also difficult because we're all so nervous and like not fully comfortable, or at least I'm not fully comfortable just being like, hey, can I do that? Hey, can I do this? So that's also a challenge. Some, I guess, goals and realizations I have are more like for the future. Like, I know comps are gonna come and they come with time. So I'm not like fully worried about it. Just because I'm also in fluoro the past 2 weeks. So like that's just what I mainly do. I don't really go do chest, or I don't really do any of like the hands and the feet. So that's my department right now. So right now I'm not really worried about comps. But when I do comps, I kind of want one of the harder texts because they're gonna ask me like all the questions, and I'd rather have them be like that so I'm better prepared. I don't know if you guys have texts like that where it's, they just go, okay, you're good, or some actually like ask you questions and ask you more detailed. For the future, like realizations I've had are to be like, keep in mind that like I want to be a helpful tech to other techs if a certain area is busy, to go help, and not just sit either in another department, but actually like try and help others. Also talking to another tech, she told me like great things about mammo, so that's kind of something I've broadly realized, that'd be a cool thing to get into. So it's more broad stuff, but yeah.
Nice. Yeah, I think I also relate to that as well. Like every tech is different with their personality, and you kind of have to just go with how they're running the show. But then I feel like it's the more experienced techs that don't really want to show you a lot because they've been there for so long, so I get it. But I'm like, wait, let me try. But so it's kind of hard to speak up in a way, but I think it will come over time. Thank you for sharing. Does
Yeah,
anyone else have anything?
yeah, I was gonna say like you were saying, I've seen that over here that some of the techs will just go, and I'm just standing there like just in the department just waiting like, okay, well there's nothing to do here. Like we just did like a barium swallow, so like we're all just standing and they have to do their work on entering the images and sending them over. So we're literally just standing there. I already checked the linen, so I'm like, okay, so that's full. So I already did any little thing that I could find. And then um and then like I happened to glance like at that monitor where all the orders are, and then I was like, oh look, like ER is busy. And then I kind of look a little more closely, and sometimes I realize that they didn't tell us to come, at least for us, because they have a lot that they rather just move and get it done. And then when it's like two or three, then they actually have us come over. We're like, oh, because they had more time to like take care of it, which is nice. But I kind of agree with you. I wish they would like be like, hey, do you guys want to come? Like we're busy. You might just get to watch, but at least but I'm still, like you said, still grateful for that, that we're still there, they to show us. And it is that the newer techs that are more willing to share. You're absolutely right on that. But it's you get to kind of like grow with it and adjust to it.
Yeah, I think once you figure out like their workflow, like I know at my site, everyone has iPhones and they're numbered. There's like 11 of them, and everyone comes in the morning and grabs a phone, and it'll have a number on it, and you put your initials on the board next to what phone you have, and then they just text. So they'll say like ED bed, whatever, X-ray, and then somebody will just go. So I keep one of the phones on me, and then just wherever their like the X-ray is, I'll just like follow and go there. Even if like the tech's not near me, I'll just meet them there. So it's kind of nice. Like, but yeah, it's like paying attention to like the workflow and stuff, and then just kind of asserting yourself in there.
Yeah, that's nice that they give you a phone. They do the same thing at cottage, and they have pagers as well, but I don't get to see it. And so they'll just like get up, and I'm like, wait, where are you going? And they're like, I'm going to get a drink. I'm like, oh, sorry.
I know we were
Fuck
laughing.
you. But, like, I
But
just
we were
know.
laughing. We had like this thing like, I'm that annoying student where I'll just like
Mhm.
pick a tech and follow them everywhere. And I'm like, the other day I like almost followed a tech to the bathroom. I'm like, oh, sorry.
That's fine. We'll get the hang of it.
Yeah.
Well, I think that wraps up the discussion unless anyone else has anything else to add. No? Okay, well, thank you guys.
Thank you.